right, Mental Health Association of San Francisco coming all the way to us here. You made the 99-mile drive?
I made that long drive last night.
It's not that long, let's be real, but we're honored to have you here. Yeah, last night. Mark Salazar, President and CEO of Mental Health Association of San Francisco. Hey, thanks for being here. It's obviously an important topic. May is a time when we're honoring, celebrating, and trying to promote and socialize mental health more than ever before. You want to start us off? Tell us a little bit about the association and what kinds of things you do. I know there's one really important thing that you guys are up to these days.
Yeah, we're a nonprofit based in the Bay. We provide peer support and case management. One of the biggest things we work on is a warm line, a peer warm line, which is run by individuals who have lived experience, who get trained and certified to provide peer counseling. It's a 24/7 warm line, and you can call it for nearly anything you want.
Wow, yeah. That's incredible. I mean, what an opportunity for people who, you're saying for anything you want. You really mean that too. It is literally things that are pressing on people, causing stress, anxiety, whatever it might be. The warm line is there for them 24/7.
24/7, you can call, text, chat. I mean, we've seen a spike from November till now, from 12,000 to 20,000 in November and December, now to 40,000.
Sure. 40,000 calls.
Calls, texts, and chats.
A month.
A month, yeah. Just want to say it's a month.
Mark, that is, so how are you staffing all of that? Like, that seems like a lot of people that you're needing, which ultimately means a lot of resources that you're having and needing in order to keep that alive.
Yeah, we're state funded, fortunately, which ends, at the end of the calendar, fiscal year, in June 30th. But it's 200 folks all over the state responding to any of those calls, texts, and chats, 15, 20, 30-minute conversations about what's going on in people's lives.
Unbelievable.
Yeah, so it does need a lot of resources.
It does. And are there ways that people can help out? This obviously is a resource that we need vitally here in our state. How can people, if they want to help and support and keep this going, we can't let this end on June 30th.
Yeah, you can visit our website, savethewarmline.org. It gives you instructions how to contact legislators, the governor's office, and all that stuff. We need a lot of folks to advocate on behalf of the warm line, because we take, prior to this year, we took about 150, 200,000 calls. Now we're projecting 500,000 per year.
Whoa.
And that projection is just in the next, we thought it would be 3 years, but it's actually probably the next year or so. And if we do that, then where does those 40,000 calls go, right?
Sure.
We did a study on it, about 14,000 calls would have ended up in ERs, and we can't have that on an annual basis going to ERs.
No.
And we've estimated the cost of those would be about $90-something million versus funding a preventative service, which is, 15, 20 minutes.
Of course. Incredible work, Mark. I know multiple languages offered. It's available 24/7. It's got that peer-to-peer vibe so that people, ideally they are getting over whatever it is that is holding them up from making a call and reaching out for help. Your people are there for them.
Yeah, you're not alone. You can literally call anybody. We are a very diverse staff from people all over the state of California, and we offer, like you said, 240 languages, live scribing. But we also have Spanish, and we work with a partner of organizations who run smaller warm lines. I've never told you this earlier.
Yeah.
They run their own little warm lines focused on smaller communities. So we have a Mandarin community, a Chinese community. We have a Black line. We have a Ukrainian line that we support. We have a Farsi and Vietnamese line that we work with. So there's a bunch of lines that we work with.
Something for everybody, which is the
Something for
intent.
everybody. Yeah. We don't want to be an organization where we can answer everybody.
Yeah.
We're not experts. There's other peers and experds all over the
that can do that work. Well, kudos to you. Save the warm line for sure. We're going to put up some information. There it is, that number, 855-600-WARM. That is the number that you can call, multiple languages, 24/7. We got to keep it going, so go online, mentalhealthsf.org, and support the warm line. Mark, thanks so much, man.
Thank you for having me.